Public service announcements. Dr.
Morning.
Polsky.
Good morning, gentlemen.
Good morning.
Good morning.
So, as we start our review this week, I will say cautious optimism would be the theme. Cautious because, as this first slide shows, this is the first week since the end of the holidays that we've actually seen an increase in cases in Calvert County. We are back up over 100 cases per week. Last week we had gotten down into the 70s. As you can see that for elementary school and middle school ages, we've seen stability. High school age, we have seen a significant bump up, a little bit more than doubling of cases in that age group, as well as young adults. As far as vaccine administration, this shows the local health departments across the state, and actually pretty much all of them are doing great. Even the health departments that are at the far end of the scale, like Allegheny, are still administering close to 100% of the vaccines that they're getting, and Calvert County, which is pretty much right in the middle there, is showing 108% again, as we talked about before, a reflection of the extra doses, so to speak, in some of the Pfizer shipments earlier that make things, give you that above 100. More importantly, when we take a look at the percentage of the population broken down by counties that have been vaccinated, Calvert is doing very well. The state average, this is for the entire population, not just eligible, meaning that this includes children. Statewide, 16% of people have been vaccinated, or 1 out of every 6 Marylanders at this point has received at least a first dose of vaccine. Calvert County, we're at 18.2%. If you take a look strictly at the adult population, 1 out of every 4 Calvert adults have been vaccinated at least a first dose at this point. Of a bit of concern, and I just want to spend a minute or two on this, is that in Southern Maryland in particular, we've seen case rates go up over the past 2 weeks. Currently, the county with the highest COVID prevalence, so this is infections, these are not vaccines. The county in the state with the highest rate of COVID infections is Charles County, and that is followed by Anne Arundel, St. Mary's, and Prince George's in that order. So when we take a look at a map, and this is case rates, the other was prevalence, or go back. So this is percent positivity. These are case rates. We've talked about that before. So there are 2 different ways of looking at the same issue. You can see that the counties that bracket us are higher in case rates, and Calvert is sort of an island, which is not terribly buffered. I did speak to the head of the state labs and state epidemiology yesterday, asking if they perhaps could take a look to see if there is an increase in the COVID variants in Southern Maryland. Apparently that's not possible with the capacity they have right now. That would be one potential explanation, is that we may have some strains down in Southern Maryland that are easier to transmit. Again, I think that the cautious optimism at this point is that our rates are certainly lower than they were going back several months ago, but our case rates right now are comparable to mid-November. They're not where we were last summer. They're about 5 to 6 times higher than that. So we're certainly not out of the woods. Good thing is that we're seeing more and more people getting vaccinated every week, and we're seeing fewer hospitalizations, although in the last 3 weeks, 8 Calvert residents have died from COVID. Keeping in mind those are people that were infected likely 3 to 4 weeks prior, but statewide we're still seeing close to 100 deaths per week. So as the CDC issues their new guidance, which I was happy to see, that for people who have been vaccinated, as long as they are in the company of other people who have completed their vaccination series, they can start to go without masks. That should not be overgeneralized. We still have to keep in mind that the virus is still very prevalent in the area, and the presence of the variants that could be more infectious or potentially even more hazardous or deadly when people get infected is very much a possibility. So people should still take cautions when they're out in public. They should still avoid large gatherings, and when they have the opportunity to get vaccinated, regardless of which of the 3, they should take that opportunity and make sure that they sign up and complete, if it's a 2-series vaccination, that they complete both shots.
Doc, are you hearing of anybody dying from the actual shot?
No. So we have not seen in Calvert County a single anaphylactic reaction. Well, that would be a serious allergic reaction. And there's been absolutely nationwide, there's been no instance of heart attacks or anything that would be a consequence of being vaccinated. So these vaccines have been extraordinarily safe. And people need to keep in mind that the virus, everybody's taking a chance, not only for themselves, but if they transmit to somebody else, what the consequence can be. So certainly the risk of the vaccine is negligible at this point, and we've all seen the consequences of the virus. And you know, we're talking strictly in health terms, but we also, again, we've touched in the past on impacts on businesses, certainly impacts on kids getting back to school. So at this point, we want to do everything we can to make sure that when the vaccines become available, people are taking advantage of that. We keep lowering the rates down, and as soon as we can, get as close as we can back to business as normal.
So there's been a real big push to get, big groups of families wanting to get their kids back into schools, and they had a big discussion over at the Republican headquarters, I heard the other night, and your name was brought up multiple times of being part of the problem is that the 6-foot rule on buses and in the classrooms is what part of the problem is. I don't know what are they doing in other counties that are going back to school? Is it they're saying that they're not 6 foot, they're closer? Have you any thoughts on that, or anything that we can do to try to get the kids going back to school?
So first off, as you're aware, kids are going back to school.
Right.
And I think by this week, the high schools are now back in school as well.
Right.
So every child whose parent feels comfortable with them going back has the opportunity to, and they are on every other week right now, but had the opportunity to get back in school.
Right.
Which is just terrific work compared to where we were a month or two ago. Maryland State Department of Education has strict rules as to when and under what circumstances people need to be quarantined if they get exposed to someone. So if you have students who are closer than 6 feet apart, if one of those students comes in with the infection, and keeping in mind that symptoms start 2 days after somebody's potentially contagious, anyone within 6 feet needs to be excluded for 2 full weeks. We have no local control over that. That's just the way it is. So the more kids you bring in at the same time, the more chance that one of those children in the classroom will carry the virus, and the more children who will need to be excluded for 2 weeks as a result. So we're caught in a bit of a dilemma. Do we do everything that we would like to do and then risk having to increase the chances we will need to exclude, and then the number of children who need to be excluded goes up? Or do we take a more moderate approach and have fewer children in the classroom, and if one of them does carry the virus, there's enough buffer around where the other kids don't need to be quarantined? And ultimately, this is not my decision. It's important to keep in mind that this is a decision by the school board, school administration. We provide advice, but I have no authority to have kids back in school. I have no authority to exclude kids from school. So what I provide, again, to the schools, and have been all the way along, is what can you do to make sure that you're maximizing the ability for kids to get back to school, keeping in mind the consequences when someone ends up bringing the virus in. And I think it's also important for families to keep in mind that we've managed to have every teacher, every teacher's aide, every bus driver, everyone in the school system who was willing to get vaccinated has had the opportunity to receive their vaccines. So that also makes sure that we're not going to have teachers out, so that teachers can be there in person for students, that the bus drivers are going to be safe and the buses are still out there to make their rounds. So there are a lot of things that have been done. In addition, we work with the school system to make sure that in the few areas of certain school buildings where airflow was not as good as we would like to see, that they had HEPA filters specifically in those areas. We have portable HEPA filters in several of the schools to make sure that we're decreasing viral counts. There's a lot of work that has been done to make sure that when the kids did get back in, that we were going to have as few quarantines as possible.
But Dr. Polsky, at the end of the day, it is you, because the school board's following your guidance. And I understand where you say it's their decision, but they are following your guidance as to how to reopen the schools. So, at the end of the day, they're trying to do what you say. So, you play a pretty significant role in how they're reopening schools. And if you look at the data, transmission between young children is very minimal. And there are examples of schools across this country that have been in normal mode, fairly normal mode, since last August that haven't had significant outbreaks. And as you say, now we have all the teachers vaccinated. We have everybody connected to the school system vaccinated, which is wonderful. So that only leaves the children, and if the parents make a conscious decision, whether they want their child physically in school or not, to me that just seems to crack that door a little wider, because the social impacts of not having kids together certainly has to come into factor when you're thinking about the decisions that we make. And as we found out, some children do learn virtually, others just cannot. They just can't do it. So those children have lost a year.
More of the younger ones,
Yes.
it seems like, yeah.
A year of education, they've lost a year of socialization, they've lost a year of athletic, there's been a significant impact. And it's just at the point we are today, I think people would like to see, a more aggressive plan to get our kids back to normal, whatever that's going to be. I understand that's not going to be what it used to be, but for those parents that assume some risk, have weighed the factors within their own families, and want to make those decisions, parents are just getting a little concerned about this.
It's becoming a point finger game. And when the parents are going to the school board, they're going, well, the health department's telling us we got to do this. And that's their way out, to not open the schools kind of thing. So I'm just trying to give you, they're getting ready to have they're going to have a rally down at the Board of Ed. And it's just a lot of stuff being stirred up. So like Buddy said, if parents feel comfortable enough to send their kids back to school, and some are doing fine at home on the virtual learning, but, they have that option to do it, kind of thing. So if we can, cut back on the distancing maybe a little bit to allow it, or work, have a work session with the school board and the health department and come up with a plan to get these kids back to school.
And I'm certainly open to further discussions. Dr.
Yeah.
Curry and I are talking again tomorrow. We know the governor has a press conference, and as usual, I have no idea
Right.
what he's going to say. But he has a press conference scheduled for this afternoon, so Dr. Curry and I are talking, we haven't said a final time, but it'll probably be somewhere around late morning tomorrow to discuss
Right.
additional options. It is not lost on me, and I have been a strong and consistent advocate of getting kids back in school.
Right.
I also am aware that about a third of parents are still keeping their kids out, and there will certainly be some who have felt comfortable at this point who may not feel comfortable if their kids are going back into a classroom with 20 other kids. Mm-hmm. And the kids have no choice in that. So there's always a trade-off with every decision that gets made.
And the longer that we keep them out, I think we're losing students to the private schools and homeschooling, and it's eventually going to be a domino effect with funding from the state. Because no matter what, the schools still have to pay all that money to maintain the schools, turn the lights on, and do all those things. And with less enrollment, we're going to be losing millions and millions of dollars. So the sooner we can get them back in school, I think that that'll help. Hopefully people will put their kids back in to trust the public schools also.
And Commissioner McConkie, I certainly don't want to get into a financial discussion that's
Right.
beyond, but every school system is going through the same thing.
Yep.
And I can't imagine that at the state level they're going to penalize every school system across the state. I think the question is into next school year,
Right.
what happens at that point?
Right.
And my hope is that well before the next school year starts, that at least the FDA will approve the vaccines for adolescents, which means middle school and high school students, where transmission rates are the same as for adults. And we shouldn't overlook the fact that although younger children, pre-adolescent children, are not as likely to transmit, they can still transmit. And still, the estimation is about 50% of the rate of an adult or a teenager. And some of those kids have grandparents, and there's still personal contact. And we can't neglect the knowledge that virus transmission doesn't stay in a classroom. So although the chances of another child becoming infected and becoming seriously ill is very, very small, any infections that get transmitted from child to child potentially then go outside of the classroom and impact other family members and people at social events. And yeah. So again, my hope is that we can continue making progress and moving forward. And I'm continuing to have discussions frequently with the schools. Honestly, no one wants these kids at home. And it's just a question of, you can't have everything you want right now. What is the most reasonable compromise in all this? So if there are other meetings that you would like me to attend, I'm certainly very willing to do that. And we'll hear what the governor says today. And again, Superintendent Curry and I will have a discussion again tomorrow.
So the other issue that came to light since our last meeting was county fields and teams, sports teams playing.
Right.
So can you talk a little bit about that decision?
Yeah. So again, it's more visually apparent here. So again, the four counties that surround us, Anne Arundel, Prince George's, Charles, and St. Mary's, right now have the four highest rates of COVID in the state. We're dealing with all the variants that you've heard about, the one that was first found in England, the one that was first found in South Africa, the one that was first found in Brazil, and now there are variants from New York and California. They're all present in the state. We don't know what's going to happen over these next few weeks. Our rate of infections has gone up, and not insignificantly. They went up by about 30% in 1 week. We had 70-some cases the week before, and we have over 100 this week. We had 3 people die from COVID last week, none the week before, 5 the week prior to that. In Calvert. And we have spring break coming up. And there's certainly potential there.
Is the strain getting weaker at all?
No.
It's not?
No.
Okay.
And the variants, although there's no conclusive proof that the variants are more deadly, there is some suggestion, at least from the one that was first discovered in the UK, but all those variants are more transmissible, and there is some degree of less protection from the vaccines. So there is legitimate concern. What we are asking for at this point is a watch period over this next month. Let's see what happens with our surrounding counties, see what happens in our county, see what happens with spring break and the variants. So we've got 3 things right now that are all in play as far as potential increase or surge in cases locally. If the counts look good 2 weeks after spring break, then I'm more than happy to say, let's just go ahead and do whatever. This previous weekend, not the one we just finished, but the one before, there was a so-called Maryland Wrestling Championship that was held just across the border in Pennsylvania. We know of at least 4 cases of COVID linked to that from people in Calvert. We don't know how many others have not been tested or were asymptomatic carriers. And so when you start having, and I will say it's not all the wrestlers themselves. Actually, 3 of the 4 cases that we know of are the parents. And so when people are doing travel, it's not just what happens on the field. It's mostly what happens on the sidelines or in the stands. And people are going to, oftentimes they're eating at restaurants or doing this, that, and the other. When you have, so we're not saying that that kids can't play sports. The fields are open. What we're saying is that we don't want travel teams going in and out and potentially bringing virus back in, or having teams from other counties bring the virus in, and really just for the next month. If the map looked different, then what I would be saying would be different. But I can't ignore what the science and the data shows. So I'm hoping that a month from now, I will have very good news, that the shadings, the colors in our surrounding counties will have gone down, that we won't have seen any major impact either from variants or from spring break. And then at that point, things open back up. I'll get back to what we were talking about earlier. The most important thing isn't what's happening with a small fraction of our kids going outside of the county to play sports. The most important thing is every child, every teenager getting back in school. Every time someone goes out to another county, brings a virus back here, that means at least one, if not multiple students are going to be excluded from school for 2 full weeks. Our focus should be on getting kids back in school.
All right.
All right.
Great. Thank you.
Thank you,
All
Doc.
right. Thank you all.
Appreciate it.
Mr. President?
Yeah, oh,
Mr.
Mike.
President?
Yes, Mike.
Yep, and Doc, I hear everything you're saying. I think the big question that I have that people keep saying to me is that most of our people that live here, work out of county. So the data has shown that for years that we're a very transient place. So the traveling's happening anyway. So they're having a disconnect of going, well, wait a minute, we haven't locked down our borders. What is the difference with teams traveling in and out? And I don't know how to answer that.
Right. So, Commissioner Hart, there is no perfect, and clearly we're not going to stop people from going to work. Work environments, most work environments tend to be a bit more controlled. For most of us, either we played sports as kids or we had children who played sports. We all know that on sidelines, some people are going to, follow guidelines, and there are going to be people, and I've seen it, and if any of you have been out to sports fields, I'm sure you've seen as well, that there are always going to be, parents, family members, anyone who's coming out who are hanging out with people from other households, no masks on. We see, not infrequently, actually for this past week when we did contact tracing, the number one gathering spot, when we ask people who have had infections, where have they gathered? It could be in a religious service, it could be at a movie theater, it could, family gatherings. The number one this week was sports gatherings. So we're not making arbitrary decisions. And it's important to keep in mind that it's not just the person, this is not a situation where I'm making a decision for myself. The decisions that people make impact others as well. And we have, again, keep in mind that team goes out, they end up with 3-4 cases of COVID as a result of traveling outside of the county. They come back, they're feeling okay when they first come back. Then there will almost certainly be other students in their classes who will now need to be excluded for 2 weeks. It's not fair to them. So there's nothing that is completely the way that we want it to be. And the question is, at this moment, and again, I emphasize I'm only talking for the next month. I'm not talking about some indefinite, but just want to see what the data shows, want to see what our case rates are locally. And if things are looking good, which I think there's a very good chance of that.
Do you get that map every month, I guess, updated?
I can bring it in every week if you like.
Oh, okay.
Yeah. So
It's
this
weekly.
is as of yesterday. So
Okay.
you can see the dates on there.
Yeah.
Yeah, through the 7th. So I guess through Sunday. Yeah, this was pulled off yesterday.
So the president said last week that by the end of May, every adult in this country that wants a shot should have one. I guess the question that some have asked is, so once all the adults get vaccinated, then are going to be able to loosen up? Or are we in a place where until all the kids get vaccinated, we're not really going to open up? What do you think about that?
It depends on what percentage of people actually get vaccinated. So having vaccine available and people getting vaccinated are certainly two different things. The epidemiologists, nationally respected epidemiologists, are saying that somewhere between 70 to 80% of people need to have solid immunity before we're not going to see continued widespread transmission. My hope is that we will see vaccination rates close. We know that for people who have had at least recent infections, that they also will have pretty strong immunity. We don't know how quickly it wears off, but it should be pretty good. So the combination of those who've been infected and those getting vaccinated, if that's getting somewhere around 75%, then my expectation would be that we'll see, if not all, at least most of the restrictions lifted. Separate question is schools, and I think there, again, you're not going to please everybody. There are going to be parents who are going to be horrified if classrooms are at full capacity and they're not going to let their kids back in. And then there are going to be parents who are upset if you don't let their kids in every day of every week. There's no making everybody happy. So whether there are polls taken of parents as to under what circumstances would they still feel comfortable with their kids going back to school and then picking, but the reality is that decisions need to be made, consequences will happen based on those, and regardless, there's always going to be somebody who's not going to be happy with the outcome.
And to your point, that no one's asked for this at all. We basically had the Spanish flu 100 years ago, and I hope we don't have to experience this for another 100 years. Some of my personal research, this was from the Baltimore Sun, an article on the 17th, and I think for most, it's the contradictions in what we hear, you know what I mean, and trying to rationalize. And for me, the quote, all things were chaos until the mind came to set things in order. This has just been chaos. So trying to place a rational discussion is difficult. This article last month, but I look for baselines, Dr. Polsky, and this was from last month. I believe it was February 17th. It was about reopening schools, and this is just one paragraph. You need to read the entire article to get the gist of it, but this is just one thing that came out at me. And it says, on Friday, the U.S. Centers for Disease Control said children are less likely to spread the virus within schools than adults when there is low-level spread within the community, a positivity rate of less than 5%, and not more than 9 new cases per 100,000 in a week. Schools can fully reopen without social distancing, but with everyone wearing masks. And then it said, in areas of high community spread, the CDC said schools should use social distancing, masking, and other mitigation factors. The CDC said schools can open safely without vaccinating teachers. So that was last month, and I guess,
And all that sounds very reasonable. And if you go back through, one of the things you said was less than 10, not 9 or less cases per 100,000. Well, last week we had over 100 cases per 100,000. So we're more than 10 times the current transmission rate than what that article says is reasonable as far as kind of like throwing the doors open. Mm-hmm. So I think the two confusing or frustrating out of lots and lots, the two main ones are that, like you just read off, there was a whole litany of statistics and criteria that were in there, and it's hard to keep all of them straight. And so people key in on one or two, they sort of forget about some others, and then, well, it meets this criterion, then why aren't we doing it? Well, because it doesn't meet this other one. And the other is that you can make all the rational statements that you want, but we're dealing with the realities of human behavior, which is not always rational. And so trying to merge those two, trying to carry the realities of human behavior into a more rational realm has been a continuing challenge in this country. So again, we will, I don't want to belabor this too much more, but we will continue to, again, talk to the schools. we have been doing a better job than our surrounding counties. And the reality is that there will be kids who will have their grandparents for their next birthday, and when the holidays roll around, that if we were at the rates at some of the other counties in the state, their grandparents would not be here this year or next year. So we're talking about, the trade-off between a small number of kids not being able to travel outside of the county to play baseball or soccer versus what are life-altering circumstances every time more infections rear up. And again, there is no perfect with this. We're all, I think people are genuinely trying to do their best and balance things that, this is not a math equation at some point. Again, in any event, we'll continue this conversation, and kids are foremost and have been foremost in my mind all the way through this.
I know they're having a board meeting this week and they're allowing public discussion from the public.
Mm-hmm.
You might want to either watch it after or during, just to kind of get an idea where parents are at. Yeah.
And we're not sheltered. We talk to people. Before I came over today, I was on the
Right.
phone with a community member. People email me. And so I think that's another, is that I think sometimes, the government is looked at as, just like in a bunker somewhere.
Mm-hmm.
We're out in the community all the time. We're talking to people. Our staff, they live here. They have kids who play sports. We're not sheltered from the consequences of the decisions.
Well, it's just last Friday we celebrated the 1-year anniversary of the first case in Maryland, and a couple weeks later all the shutdowns started, and nobody thought we'd be where we are today. And
No, and
There's a
I will say that if behaviors had been different, we wouldn't be here where we are today. And we all collectively have some responsibility in what's happened.
well, we're a country made up of freedoms, and it's hard to give up those freedoms. So
We're a country
it's our
made up of
nature.
some other things as well.
So we
Yeah.
appreciate you coming in every week, and I don't know if Commissioner Hutchins or Hart have anything else to add.
No, thank you, Mr. President. No, but Doctor, thank you for what you and your staff are continuing to do. It's a long road, and it's a road that's not well defined, and you're doing the best job you can, and I fully support you there.
Thank you, Commissioner.
Commissioner Hart? Okay, well, we thank you, Dr. Polsky, for coming in again this week, and I guess we'll see you next time.
All right, thank you very much.
Thank you.
Thank
Have
you.
a great day.
Thanks.